KEA Tutorials presents Schizophrenia. Schizophrenia is a serious mental condition characterized by impaired communication, loss of contact with reality, and deterioration from a previous level of functioning at work, social relationship, or self-care. The various forms of schizophrenia are: paranoid schizophrenia. This is the most common type of schizophrenia. It may develop later in life than other forms. Symptoms include hallucinations and delusions, but your speech and emotions may not be affected. Schizophrenic schizophrenia, also known as disorganized schizophrenia. This type of schizophrenia typically develops when you're 15 to 25 years old. Symptoms include disorganized behaviors and thoughts, alongside short-lasting delusions and hallucinations. You may have disorganized speech patterns and others may find it difficult to understand you. People living with disorganized schizophrenia often show little or no emotions in their facial expressions, voice tone, or mannerisms. Catatonic schizophrenia. This is the rarest schizophrenia diagnosis, characterized by unusual, limited and sudden movements. You may often switch between being very active or very still. You may not talk much, and you may mimic others' speech and movement. Undifferentiated schizophrenia. Your diagnosis may have some signs of paranoid, schizophrenic, or catatonic schizophrenia, but it doesn't obviously fit into one of these types alone. Residual schizophrenia. You may be diagnosed with residual schizophrenia if you have a history of psychosis, but only experience the negative symptoms, such as slow movement, poor memory, lack of concentration and poor hygiene. Schizophrenia is sometimes described as having positive symptoms and negative symptoms. Positive symptoms are experienced in addition to reality, whereas negative symptoms affect your ability to function. Positive symptoms are experienced in addition to reality. These symptoms include hallucinations, seeing, feeling and hearing things that aren't there. Hearing voices is the most common type of hallucination. Delusions, believing things that others don't. Disorganized thinking, the things you say might not make sense to other people. You may switch topics without any obvious link. The negative symptoms of schizophrenia are those affecting one's ability to function. These symptoms include lack of motivation, slow movement, change in sleep patterns, poor grooming or hygiene, difficulty planning or setting goals, reduced range of emotions. Now let's dive into the causes of schizophrenia. The cause of schizophrenia is unknown, but it is usually a combination of the following factors: brain chemistry, genetics, complications at birth, stressful events, such as the death of a loved one or the loss of a job, can trigger the development of schizophrenia. There's also a strong link between the use of strong cannabis and the development of schizophrenia. Let's dive now into treatment. The pharmacologic treatment of schizophrenia include antipsychotic medications, which will limit the symptoms of this condition. The non-pharmacologic approach to schizophrenia is more of a therapy-like approach. This includes cognitive behavioral therapy and family therapy. Interventions for patients suffering from this condition include exercise, healthy diet, proper hygiene practices, taking medications, and maintaining relationships, all of which are factors to consider when caring for patients suffering from schizophrenia. Thanks for watching. Don't forget to subscribe and smash the notification icon so that YouTube keeps you updated of our activities. See you in another video.